Thank you so much for the opportunity and the platform. LAGOM is on a mission to heal our healers. So do we really know our healthcare professionals here? I'm sure all of us would have met at least one healthcare professional in the past month if you got your booster. But 1 in 6 have mental illness. Among healthcare professionals, we see a much higher incidence of severe anxiety, depression, trauma, 82% having severe burnout, according to a study done by IMH last September. No wonder we are seeing thousands leaving this profession that they once found deep meaning in. And 1 doctor dies by suicide every 3 to 4 weeks globally. LAGOM really wants to support our wounded healers. And this is a problem that we've been shoving under the rug for far too long. I know this because I went to medical school in China. And coming from Singapore, all I knew was ER Sansu Ulio until 100, a few swear words, and that was it. But medical school was difficult because it was so competitive and toxic. And that just filled me with so much anxiety. And the insomnia only got worse when I got to clinical rotations. I was only 19 years old when I lost my first patient, Tian Tian. And I could not process the grief because I had no one to talk to, no support, no advocacy, and I completely broke down. And I started to wonder, am I the only one suffering this way? Am I the only one isolated in this problem? And I started talking to my peers, my colleagues, and I realized something even more shocking. So many of us have suicidal ideation and tendencies, and yet no one seeks professional psychiatric help because of the fear of stigma. And we know that it would definitely affect our careers and residency placements. And COVID-19 has just led to an ultimate burnout. Henry here is a physiotherapist and my childhood friend, and he too has gone through so much mental distress, which is why we feel so passionately about this cause. We've gone through the design thinking process and we've conducted 19 design user interviews, and we see these themes repeated again and again. A lack of self-care, abuse from patients, from public, a nagging sense of anxiety and imposter syndrome. And we've further corroborated this through 274 online surveys, and we've also conducted interviews with welfare officers in Sengkang General Hospital and KKH. This is why LAGOM really wants to support by filling up these gaps. And we want to do this in an empathy-driven, human-centric approach by healthcare professionals for healthcare professionals. So we envision that junior healthcare professionals would have their journey like this. They would have the power of community support with LAGOM, where they can create tribes with like-minded healthcare professionals in various different interest groups, be it through sports or mindfulness events. And then they would also be able to tap on mentorship opportunities, where there would be a senior who would be empathizing with them through their mental distress. They would also have a one-stop digital platform of mindfulness and educational content right at their fingertips, accessible 24/7, and psychiatry first aid. This is a set of evidence-based medicine guidelines on how exactly to deal with acute psychiatric emergencies for our patients, colleagues, and even our own selves. And this way, we'll be creating a generation of junior healthcare professionals who are emotionally resilient through our personalized solutions. And also through the community, we'll be capturing data through clinical trials which are underway with Sengkang General Hospital and KKH. And this way, we'd be able to push for public policy change, not just in Singapore, but globally as well. The marketplace of mindfulness resources is also accessible 24/7. And the psychiatry first aid is long-term educational support in terms of improving screening, diagnosis, and even prevention of comorbidities. This way, we see massive impacts in the economics of well-being, where we are improving the productivity of healthcare professionals. We see improved patient outcomes, reduced hospital durations. For the practitioners themselves, they will have reduced burnout and medical mistakes. So this one life that you invest in can help save 90 more.
We aim to make LAGOM a sustainable social venture. So our beachhead market being Singapore, we are looking at our SOM being at $11.6 million and our total addressable market being $9.4 billion. Our initial customer profile will be junior healthcare professionals and medical students. So our business model is based off two major revenue streams. Firstly will be a membership-based subscription model where we are charging $8.99 per month for a Plus member and $199 per year for Pro member. And then we also have the second stream, which is where we will be also providing a first aid certification course, which will be at $49.90. So based on these two revenue streams itself, we will be breaking even at 18th month mark based on our projections at the start of our operations. We've also been pushing LAGOM for new heights by conducting user interviews and surveys. The goal for 2021 for us was to basically, the goal for us in 2021 was to establish the problem itself, and that's the reason why we started with YAC. We conducted 274 online surveys to establish the problem, and also 19 primary surveys to understand the issues beyond the problem itself. We have also been able, through our social media, we've been able to reach more than 20,000 people, and also have conducted 10 events in total as a pilot test, whereby we would have participation of 30 to 60 people in each event. We've also had partnership with established organizations and healthcare NGOs such as MMI, Atma Yogashala, and Effective Altruism. Next slide. Our ask is $62,000, whereby we have already gotten $12,000 from D4I competition that we won, and the rest we're looking through YAC. And this is the breakdown. Thank you so much. We'll now open the floor to any questions. We do have a few more slides in terms of how do we go to market, but due to lack of time, we will skip that for now. Yeah.
Right, thank you very much. We will now proceed to the Q&A.
Yeah.
All right, judges, please.
Thank you very much for your presentation. This is indeed a pressing problem, especially in light of the current pandemic. I just wanted to understand if you have also done a scan of existing support structures locally as well as globally, in particular because you're also making references to creation of memberships. There's also the Singapore Medical Association, and I just wanted to know what your sense is of the supports already available. The government's also looking at the, for example, mental well-being of junior doctors, and there's some efforts in that front. So I just wanted to get a sense, because you did surveys and you spoke to healthcare workers. What is your thinking of that? And then also the likelihood of people wanting to join as members, especially because existing membership platforms.
Okay, maybe I can kickstart on this and Henry can supplement me. So as for existing efforts, there are well-being committees in each hospital. However, we see that the engagement rate is not a lot. We've gotten the data from the hospitals themselves. In NUHS, Sengkang General Hospital, there's different clusters in Singapore, and therefore it's very isolated. And like I mentioned, there's the fear of stigma, because whatever is reported in the hospital will definitely be going on to the residency committee, and that would affect their career progression. Yeah.
A lot of these, whenever they do like an outreach within the hospital itself, there is that potential conflict of interest, as what Vaish have mentioned just now. Sometimes certain things can become sort of serious in the eyes of the human resource department that gets flagged up. So that's one thing. But the other issue that these well-being committees in hospitals themselves are doing are quite glossy in nature, in the sense that they pick up lots of mindfulness activities, which is really scratching the surface of all the unspoken grief and trauma. And it's not a simple 45-minute Zoom session can handle as well.
So to answer part B of your question, Mr. Hayu, whether people really want this. So I can see this for myself in Henry and also all the peers that we are working with. This is something that has been validated through our online surveys and interviews, because there isn't a deepness in how we are approaching the problem. We're not looking at this in a functional medicine approach, which is why our psychiatry first aid is so important, because there's a body-mind connection where your physical health can affect your mental health. And there's this neuroscience backing to this and behavioral science informed strategies. And that is why our solution would really give a more holistic 360 view to mental health.
I have a question on your go-to-market strategy.
Yep.
Given that this is a pretty sensitive issue and the stigma that's attached to it, and I'm sure a lot of healthcare workers, doctors, may not be even aware that they are having a mental health issue or they are borderline depressive. How would you drive or at least encourage the adoption of your solution in this space?
Yep. So I think one of the largest challenge that we have in terms of going to market is the stigma itself that's stemming from this whole mental health situation. So what we want to do is that we want to create a private sort of community first. So our first goal will be to building that community. So we want to build a healthcare community whereby when you log into our app itself, you'll be given these cue cards, which basically identifies your traits and your personas and your current healthcare profession stuff. And based on that, it groups you into a certain tribes. And those tribes will become your sort of base as to not only connect with people, also share your thoughts and emotions as you're going through them. And these tribes are usually not necessarily from the same hospitals, so we are splitting them across the geography as well as the location, so it can be someone from the overseas as well as local people as well. So that removes them from that worry of being sort of like subjectified in terms of the career progression, because you don't have to worry about that, as every single one of them are not really affecting you in terms of the hospitals that you're working at. So that's the first part in terms of building the community. Then we want to push it further by creating these webinars on a monthly basis, whereby we introduce to them all these mental health courses and mindfulness activities. And lastly, we also provide a private mentorship to each sort of member, whereby we bring in healthcare professionals, senior professionals who are from different countries to guide them in their day-to-day challenges. And we are hoping with those alone, we'll be able to open their eyes in terms of like the kind of effect that it has to them, and also showcasing the adoption itself. Yeah.
I think another important point to add, if I may, is that we're not trying to target only healthcare professionals who are in the deep end, who are like, completely suffering and they're having a severe mental illness. We're trying to bring out this idea that physical health, right? Like we do exercise, nutrition, all this sort of things. But what are we doing for our mental fitness? What are we doing to really help the neuroplasticity of the brain? And who else would understand these concepts better than healthcare professionals? And that way we'll create a rolling snowball effect where our healthcare professionals can help our colleagues as first line of defense. And the whole oxygen mask analysis, like you need to self-care for yourself before you can help others. So that way, we'll be able to help society at large when we can take care of ourselves first.
All right. I'm sorry, judges. Due to the interest of time, maybe we could hold on the questions maybe later on.